Good morning, everybody. It's such a pleasure to be here. When Sean first invited me to join you and to talk to a community of folks who are really at the heart of prevention, treatment, and research in HIV, in the HIV space, it was a topic that was really close to my heart. I remember being a college student in Ithaca in the early 90s and being involved in some of the first ZAP panels, which were about talking to our peers about what it meant to live in different kinds of relationships and being part of some of the early AIDS activist movements in Ithaca, New York. And so it was really interesting for me to come back to some of those early roots in this presentation. And also interesting to talk about Health 2.0, which I'm going to get into in a few minutes, because it's really remarkable to be in a room like this about 7 years since the inception of the movement, if you will. We really began on the fringes of clinical medicine and research. It was a consumer-initiated movement, in some ways not taken too seriously by the mainstream. And it's taken a number of years to be recognized by the clinical establishment, and now to be in a world, in a room of researchers, I think is just really testament to the growth of the space and the credibility and the impact that it's having. So what I'm going to do is throughout the day, you're going to hear about tremendous presentations from your colleagues who are actually doing the innovative technologies and bringing them to bear in HIV. I'm going to give an overview of the digital health ecosystem, a little bit of the history, and maybe that'll give a context for the conversations to follow. So with that, let's go to my first slide. So what is Health 2.0? And I always like to begin with the definition of Web 2.0, which is now crazily 10 years old. It used to be that I used to say, oh, just a few years ago. But Web 2.0 is a term coined by Tim O'Reilly in 2003, referring to a class of technologies that shared a number of common elements that you can see listed in this word cloud. It was lightweight software. It was about social sharing. It was about easy interfaces. And it allowed people to self-publish and connect with each other in ways that they'd never been able to do before. And we're now talking about the precursors to Facebook and Twitter and all the things that Sean showed in that really incredible video. And where we came about in about 2006, Health 2.0, a group of folks were talking about what it would mean to apply these principles in healthcare. What if you had a class of technologies that would allow people to connect, inform, and transform health using these accessible tools? So we proposed a definition for Health 2.0. And there are now in about 70 cities around the world, chapters of self-identified entrepreneurs that call themselves Health 2.0. What do they share? What do these technologies share in common? We think of three elements. The first is they're building adaptable technologies. They're not building solutions that stand alone and don't talk to the rest of the ecosystem and technology out there. This is a fundamental tenet of what is a Health 2.0 technology. It's adaptable and it plays well with others in our connected universe that we live in today. The second is that it has a staunch focus on the user experience. I think many of us in research and clinical settings are used to seeing very old school interfaces that are impossible to use and hard. We wouldn't really call that a Health 2.0 tool, not because it's not pretty, but because it's not really designed around the user, whether that user is a person, patient, researcher, doctor, etc. This is very important. And third, these tools share an element of using data to help drive intelligent decision making. So it's not so much about just capturing information and storing it and being a repository, but are you able to feed it back to somebody who's in a position to make an informed decision? These tools must do that. We're now looking at about over 2,500 companies that meet these criteria around the world, and the space is growing continually. We see them in 19 categories we've defined, ranging from tools that just serve consumers, that's just for lack of a better term, and as well as professional-facing tools. And I'll refer to three spheres in which these tools originally fell, and then talk about the progression. So when Health 2.0 began as a field, if you will, or a movement, we were looking at some of the earliest tools in search, social networks, and tools. By search, it was the first going online to find out answers to simple questions using Google, but then later a search engine specifically for health. And now, of course, this category has come as far as being able to get instant answers on your iPhone from a professional somewhere in the world that's vetted and qualified. So search is an important part of Health 2.0 in terms of the definition, because it allows for access to information, even though the mediums and mechanisms of that have changed over time. Social networks are a big component. You're going to see it throughout the day in some way, shape, or form, the fact that we're connected in communities, communities ranging from our friends, our families, to communities that I'll give examples of, which are full of so many thousands of people with specific health conditions that they're forming almost clinical trials virtually. And finally, this category of tools, which means anything that allows you to make a decision, make a transaction, and go beyond just content. So this was sort of one of the first schematics of describing Health 2.0, and ultimately in healthcare, there's many transactions, office visits, interactions with payers and providers, but that were devoid of the information and the content that would make those interactions meaningful. We see Health 2.0 as a way of connecting those dots. And I also want to present a four-stage view of this, that initially, a lot of these technologies were around connecting users, people living with conditions, to each other outside of the healthcare system and outside of the research establishment today. Like I mentioned earlier, it was really happening out there on its own, people coming together to share information about their health. And gradually over time, you began to see the connection of these technologies to systems. So we had the stage of users connecting to providers through some of the first video conferencing with doctors, email messaging, et cetera. And then began to see partnerships to reform delivery, that as consumers and patients got engaged with care delivery, the way care was delivered began to change necessarily, and the way we pay for care also began to change. And finally, hopefully with this progression, ultimately the whole system becomes a more informed one where data really drives decisions. And one of the topics you'll see throughout the day as well is what we mean by data, and how it really makes itself useful in the context of digital technology. There's really now a huge moment and opportunity to take all of the activity and all of the examples of the tools that were shown in that first video and more that you're going to be hearing about, to really harness the power of data. And you're all familiar with data. It's at the core of research. We think of data in many, many stacks. So there's data now coming out in abundance from self-tracking devices, from the human genome, from open government databases, from reference databases. But the ability now of technology platforms that we call data utility layers, it could be a large health plans database, it could be a large EMR, it could be Microsoft Health Vault. A data utility layer has the ability to bring in data from multiple sources and integrate it and standardize it. And then there's this ecosystem of applications, and we call them unplatforms because it's not just about your mobile phone. It could be about your intelligent coffee maker. It could be about a very cutting-edge, non-invasive medical device. There are these interfaces that are now a part of life in many ways, shapes, and forms that can tap into a common data utility layer and take advantage of all the sources of data that we now are generating, and ultimately surface that up to individuals to inform decision-making and action. So this is our schematic for how we think of the world, and we encourage people to think beyond mobile, beyond just the cell phone, even though you hear about that. It's really going to be in many, many, many applications. It's going to be in what you wear. It's going to be in your home and the appliances you use. I'm going to give just a few examples outside of HIV, because you're going to be hearing so many from within the space through the remainder of the day. But I wanted to give 3 examples of how data and digital really converge to make a difference. How many of you are familiar with patients like me? A fair number, but for those of you who aren't, I use this example just to illustrate a simple point about Health 2.0 and the power of it. So patients like me began as a community of individuals. It wasn't started by a corporation or a drug company or a hospital or a doctor. It was by 2 brothers who lost a 3rd brother to Lou Gehrig's disease, also known as ALS, and it really disturbed them greatly as to why there weren't answers, better information around their brother's condition that was ultimately terminal. And so patients like me allowed anyone to go on and report information about your health, your symptoms, your everyday life, the medications you were taking. And when they first started, everybody thought, well, that's great. It's allowing people to share support and pat each other in the back and make each other feel good. It certainly was doing that, but it was doing far more. And over the years, Patients Like Me has accrued now some, I don't even know the latest number, and I would be quoting you the wrong one, but I know as of a few years ago, just in their Parkinson's community alone, they had about 30,000 patients, and that was greater than the number of many clinical trials that were able to be tracking patients in that space. And the data that they were gathering, because people were systematically reporting symptoms and medications, they were able to publish findings in peer-reviewed journals like the ones you publish in that were rivaling the best medical studies, because they had now longitudinal data over many years from a large subset of the target population, in some ways the largest. And so suddenly that got really interesting, and pharma got interested, and a lot of medical device companies got interested, and you begin to see how the simple fact of, I grew up in research as well, and we used to talk about patient-reported outcomes on paper, quality of life surveys and all of that. The power of this was that on steroids. And so I give this example of Patients Like Me to show the power of networking and community to actually now inform science and research and discovery. This is another map from a company called MedHelp, also a community of Patients Like Me, but in MedHelp's case, they connect providers, professionals, doctors, nurses, you name it. And it's a community of both the patient and the caregiver, and they're able to do phenomenal data analysis around, here's just something called symptom co-occurrence, the ability to correlate symptoms across a large population and draw some meaningful insights. This one is another favorite example of mine to give, only because it symbolizes an example of many things like it. But this is a company called Asthmopolis, and also I think they just renamed themselves to Propeller Health. And it's for people with asthma. So if you think of asthma and the use of an inhaler, what would happen if you attached a GPS component to that inhaler? And so now anybody using their inhaler in a community can send data about their asthma to a map. So not only for people studying population health is that useful, so you can get to see where there's maybe an outbreak, but for the individual, you're now able to give that person feedback about their patterns of triggers so that they can visualize it. And the person who founded this company was giving me an interesting example about people on their commutes. They were able to say, oh boy, when the train literally passed through that neighborhood, my asthma was worse, and they were able to see about pollutants in the air and other triggers for this condition. And that's just an example of what's possible. What else might be possible if you could put GPS and some of these devices and tools that are used to monitor disease. And finally, in the clinical setting and research setting, I would say this is an example of a category of company that's very exciting, and I would call them population health management dashboard companies. They're companies that are taking the clinical data points, so each triangle or dot is a patient, like we've seen this a million times, but what it's able to do, in this case it's looking at blood levels and LDL and a few values, but it's able to let you toggle quickly between the individual patient or case record and the population at risk. And what you can then do is adjust, titrate, change colors, manipulate, and this visualization component to go quickly from the individual to the population also yields tremendous insights and can be very powerful. And if you can do that for millions of patients at a time, just imagine the power of that. So I would say these are just a few examples of the types of the convergence of, I think, data and digital that's so exciting. And I'll say that, that's just sort of setting the stage for the tremendous opportunity in HIV. But just to give you sort of 5 trends that are swimming around in the ether around the space of this community, we talked about 5 trends in the fall of this past year when we did Health 2.0, which is an annual conference in San Francisco. And I'll just go over these and then maybe just give a couple of examples in HIV before you hear from amazing speakers to follow. But so where are we me today. We talked a little bit about the history of the space, what you can do with digital and data. What are some of the eye-opening trends that we're seeing from a macro perspective? And the first is, you can hear a lot about this, but self-tracking and self-monitoring. Now, we're going to learn about why this matters in the at-risk populations you're talking about, but I would say, even from my perspective of doing Health 2.0 every day and having the honor of seeing these amazing companies, the last year and a half, something has changed. I now know more and more people that actually wear, Fitbits and trackers. My husband, and here we live in Los Angeles, not really a big health freak at all, but in the last year, started on MyFitnessPal and started wearing Fitbits and went through a whole bunch of devices, and he said it changed his life. He said he developed such an awareness of what he was eating, how much he was working out, and it's almost gotten to the point that at dinner now it's annoying. I'm like, what are you doing? He's like, I'm just updating MyFitnessPal. It's interrupting the conversation. But he's been doing it for 9 months every day religiously. I couldn't do it. I'm not that religious, a self-tracker, but this is an important trend, and more people are. I didn't believe it. I kept thinking, who's going to take the trouble? People take the trouble, maybe not everybody, and we're going to learn what segments of these communities will adopt technologies like this and who won't, but you'll be surprised as to who will. So I mentioned this rise of the mainstreaming of the self-tracking movement. It always existed. They used to call themselves the quantified self movement. It still exists. Really, really hardcore people who track everything about themselves, but it's expanding. And this is Susanna Fox's data from the Pew Internet study, and she's presented this data before, which says 7 in 10 US adults track for health, whether it's on paper or using technology, but she just presented that even among those with chronic disease, there's a new report out you should check out, that 45% of US adults with a chronic disease, 7 out of 10 of those are tracking for health as well. And it was very interesting to see whether those living with disease wouldn't track as much as the healthy population, and vice versa. So I would pay attention to Susanna's findings in this space. And these devices are being used for research. So here's an example of a study, Fitbit, which tracks your steps, kind of a lightweight retail consumer product, is being used at the Mayo Clinic to predict, surgical recovery time. So that among people who've just had surgery, that affects their mobility. So I think we're going to see the integration of these devices in the clinical and the research setting more and more. The FDA has just passed first-round regulation advisory on mobile. I think we're going to be hearing more about that and its implications. The second trend, the first being sort of self-tracking going mainstream. The second trend is this, we call it like sort of the Star Trekification of Health 2.0. And I would say it's very exciting that as you think about new technology, always encouraging people to think beyond the smartphone, that Google Glass and augmented reality technologies are here. They used to be very much obscure and limited in the research setting. I tried my first pair of Google Glasses on a few months ago, where you're going to be able to see multiple screens at the same time out of the corner of your eye, and all sorts of weird stuff like that. But it's going to have implications in the clinical setting and research. And this is Ellie. She's a face-reading robot that you have a conversation with her, and she can tell if you're depressed because of the answers you're giving to questions not about depression, literally about something else, because she's so highly trained. And these artificial intelligence systems and augmented reality systems, I think, are a trend that are now becoming to be real, not just sort of science fiction. This is an example of a laser knife that can analyze the cancer tissue it cuts in real time. The trend number 3, and this probably has implications for HIV and the work you all do, is that large health systems for the first time are really beginning to open channels to engage patients in ways they haven't before. And we're seeing efforts now out of New York's eHealth Collaborative, a group of 20 plus hospitals that have opened up patient data to patients now, over 20 million records available to people in New York, connecting directly to your hospitals. The National Health Service in the UK making similar efforts with huge investment in patient data and patient access to data. And finally, the third symbol over there is the Blue Button Initiative, spearheaded by the VA in this country, that should allow anybody with the touch of a button to download their health data. It's still not a reality for all of us in the United States, but the vision is that as organizations partner to be Blue Button members, they're gonna promise to make available their data. And the power of that, you can see, as we talked about earlier, when data is available, what the community of entrepreneurs, consumers, and providers can do with that. And it matters, people are willing to switch doctors if they don't have electronic access to their information. A study from Accenture just recently came out. And trend 4, I think this is maybe relevant to some folks in the room here. At Health 2.0, when we use the word health, we've always meant a very, very broad definition of health, and we've been championing this from the day one. We have a panel called the Unmentionables every year, which are about health issues that are hard to talk about, and that the mainstream healthcare organization doesn't want to talk about, and we really, really shine a light on it. And I think the idea is that increasingly people are acknowledging that aspects of life that we don't typically think of as having to do with health, our sex lives, our financial stress, substance use, et cetera, really, really determine health. And mainstream organizations like health plans and others are beginning to notice even things like mindfulness as being taught in schools, and spirituality, whatever that means to folks in whatever way, is becoming seen as not the sort of, foo-foo ideal out there, and very strongly connected to health outcomes. And I won't dwell too much on our fifth observation, which is the fact that federal policy is changing to really support data transparency, entrepreneurial innovation, and this notion of the accountable care model, which is that organizations aren't going to be paid anymore for the care of just provision of services, but it's really about how you manage a population and how you account for their improved outcomes over time. That's sort of the premise behind the Affordable Care Act that gets lost in some of the media and the noise that we hear. But we really sort of believe in that model of looking at patient outcomes as a whole and paying for the improvement of that, as opposed to just more testing and more delivery of services. So with that, I have just a few examples of how Health 2.0 translates into HIV, but I don't want to go too much into that because I think the rest of our presenters are going to do that today. But I will share with you just this graphic that I put together just thinking about this audience. And I thought, well, social media and the term that Sean used, sometimes we relegate to just the aspect of information delivery or information sharing, and it stays in this context of information. But I thought, well, what if you took the full spectrum of somebody living with HIV, and I know HIV and then there's AIDS, and it's two different things, maybe they're connected, whichever way you think about it, there's a spectrum of needs and a spectrum of health and disease. And at every end of it, there is, I would encourage you to think about where technology plays a role, not just in the education and the outreach, but all the way around the circle. So yes, content and education are important. Access to resources and services, connecting with a doctor, provider, nurse, researcher, community, caregiver, building community within and among these sub-communities. That's an important function. The caregivers, there's now tools and platforms to connect the caregivers and make their lives easier. The data aspect, how do you study trends and look at patterns? We saw some examples of that. Self-care, not everybody is going to come into a clinic all the time for everything that they need. More and more is happening in people's homes and where they are. How can these tools help with that? And end-of-life care, even though it may not be what we think about in HIV anymore as a condition you can live with healthily for many, many years, in some cases it progresses, and there's Health 2.0 technologies about talking about the hard decisions at end of life. How do you plan for your advanced directives? How do you communicate with family members? So it's really important to think not just about that front end, but about the whole spectrum and how you can leverage some of these tools in the work that you're doing wherever you are in this. And just to give a few examples that I'm sure are going to come up later, an example of a Q&A platform for people at shared care around HIV. This was a great little tool that we saw debuting in Europe a few months ago for young kids to ask hard questions about sex, and how great they actually polled people and teenagers teenagers and kids who had their questions, and that's how they came up with the questions, and then they asked, doctors to answer it. But it's at their fingertips, it's private. We don't think about necessarily food all the time in terms of health and the work we do, but food choices, and there's so many tools now to be able to scan barcodes with your phone and know whether that sugary cereal you're eating is actually good for you or not. Amazing stuff, like it's shocking how you can scan the wrapper of literally the snack you just threw out and learn everything about its nutritional content in 2 seconds. So it may not be central from the HIV standpoint, but thinking about the whole person, it is about the choices they need to make and how they're going to live and lead a good life. Of course, you're going to hear more from Ramin later today, but the STD testing, the facilities, the tools around that, there's a proliferation of applications here. Resources, again, to build technologies and solutions to these on the mobile phone level, connecting to doctors online, just some example of communities here, and more. So a caregiving community called CareSync. So I think this is just scratching the surface of what's out there and what's possible. And of course, we saw a number of companies helping with the data visualization. And I'll close on this topic, because I think I'm at the end of my presentation and the end of my time, and that is, what is the role of somebody working in the community like yourself? And I would really invite you to think about the perspective you bring to this entrepreneurial innovation community. A lot of folks that are building these tools and solutions are passionate about the technology, but they don't know the community. They don't know the specific concerns of the patients and the people that you're working with, the issues that concern you as researchers, your specific questions. There are ways of collaborating, whether it's through what are called hackathons, where people come in a room and build technologies. We bring your expertise. You don't have to be a technologist yourself. Connecting with people working in the space. Some of the work Sean is doing in his interdepartmental vision of a group with people from engineering and medicine. So there's ways of getting involved, and I really encourage you all, and I wish you the best in your mission and your work. Thank you.